Assalamu alaikum. Good afternoon, everyone. It's so wonderful to see you all in our Facebook Live in Medical Burjeel Center, Barari, with our always smiling doctor. Please join me to welcome Dr. Chintan Vyas. Hello, Dr. Chintan.
Hello, how are you? Welcome.
How are you, Doctor? Kuntu
Doctor,
tamam?
I'm fine. Everything is good.
Good, good. Doctor, today we are talking us about diabetes
Okay.
with how the rise with diabetes. So to start, doctor, what is the diabetes?
Actually, diabetes is a metabolic disease, and it is characterized by high blood sugar in our body.
Yes.
So, normally, when a person takes a food, there is amount of insulin which is secreted from our pancreas and which controls the sugar. But
Okay.
in patients of diabetes, there is a deficiency of insulin so that the person's blood sugar will continuously remain high, as well as also the liver production from the sugar also increase. So
Yes.
these two abnormalities occurs in patients of diabetes mellitus.
Okay, doctor. So, doctor, how do I know that I have diabetes or not? Is there any symptoms?
Yes, that's a good question. Actually, diabetes is a iceberg disease. So
Okay.
iceberg means that you can see only a few portion of the patients with diabetes in the outside the world, but many of them are behind the below the ice. So in a world, approximately 9% of the population has diabetes, which is very huge.
Yes.
So this is the thing, but I want to emphasize that few of the patients will develop symptoms of the diabetes, while few of them may not develop diabetes symptoms.
Okay.
General symptoms are due to increase of blood sugar in our body. So that's why the blood sugar increases in our body and it will pass through the urine. So most of the patient will have like frequency of the urine, and
Frequent.
the patient will have the weight loss because the sugar as well as some nutrients are lost in the body. So this is also one of the symptom. Many of the patients has come with like symptoms of some complications. For example, like patients will come with the neuropathic symptoms, tingling and numbness in the legs,
Yes.
joint pains, dizziness,
Yes.
headache. So these are the various types of the symptoms. So we need to identify the diabetes at the early stage so that we can diagnose and treat it early.
Okay, doctor. So, doctor, what risk factors increase the likelihood of diabetes?
Okay. Most important risk factor is the obesity, and
Obesity. Okay.
we have all of the person have like body mass index. So
Okay.
body mass index is like a proportion of weight divided by the height into the square. So normal body mass index is 18 to 25. If 25 to 30, the person is called as overweight. If it
Okay.
is more than 30, it is called as a obesity. So obesity is the most important risk factor for the development of diabetes.
Diabetes.
You have seen that nowadays there is sedentary lifestyle is there, unhealthy food habits are there, physical inactivity are there,
Okay.
and on top of that, if a person, father, mother, or parents or any others have the diabetes, that also increases the likelihood of diabetes because it is also there is some genetic components are also there.
Okay, doctor, for that point, for example, for me, my family history has diabetes. For example, my mother, she is diabetic.
Okay.
So, how do I test for diabetes?
Well, you have to, whenever there is high suspicion of the diabetes, for example, family history of diabetes is there. So you have to screen yourself. So the most important thing that you have to do the blood test. There is which we call as a glucose tolerance test. So
Okay.
what is glucose tolerance test? In that there is a blood sample has been drawn. You will be taken the fasting sample. Plus, after that, the nurse will give you the 75 gram of glucose,
Okay.
and then you have to do the another blood test after 1 hour as well as after 2 hours. So there are some criterias are there. So if after the 2 hour of the 75-gram glucose test, if the blood sugar is more than 200, and if the fasting sugar is more than 126, this is considered as diabetes.
Right. Okay. Okay, doctor. So why diabetes is very important disease?
Okay, so as I mentioned earlier, that diabetes is an iceberg disease. So I have seen many of the patients when they come to me first time, they are already having complications established in their body. So diabetes is itself, it's not a disease, but it leads to many of the complications, which
Okay.
unless we go to the doctor and diagnose early, you are not able to know. So the most important complication of the diabetes is the brain stroke. So the complications occurs due to the vascular disease, which we call as a macrovascular complications. Then it affects the eyes. I have
Okay.
seen many patients with the blindness and reduced vision, and they have diagnosed as diabetes first time. Another risk complication is that heart problem. So all
Okay.
diabetic patients have at least 5 to 10 times higher risk of developing heart problems and ischemic heart disease, heart attack like this. So that is why diabetes is very important. We need to control it accurately.
Yes, doctor. Doctor, another thing, like nowadays we have too many like work or family problems or something else, so it's make us stress, more stressful. So can stress increase blood sugar level?
Yes, stress definitely has been linked to increase of the blood sugar, not actually directly, but it is through the indirect pathway. So whenever there is a stressful situation
Yes.
in our body, there is some hormones are being secreted, which is called as adrenaline and the glucocorticoids, which is a steroid hormones. So these hormones act through the carbohydrate metabolism, and thereby it increases the blood sugar. So continuous stress is it's also one of the risk factor for
Yes.
developing diabetes.
Okay, doctor. So another question is, what is pre-diabetes and why it's important?
Okay, so this is a good question. Pre-diabetics are basically condition in between a normal person and the diabetic person.
Okay.
So what happens that, as I said mentioned earlier, the pre-diabetics can also will not manifest many symptoms like diabetes, but pre-diabetics there is a sugar range is there. So as I mentioned that if we do this 75-gram glucose test,
Okay.
so if the sugar of the fasting blood sugar if it is between 100 to 125, and after 2 hours of the glucose tolerance test, if you do the blood test and if it is between 140 to 200, this is called as a pre-diabetic. We also
Pre-diabetes.
called as a impaired fasting glucose. So why it is important that if we detect the pre-diabetics in the early stage, we can prevent it, and further progression to the diabetes we can prevent it by doing the lifestyle modifications.
Okay. Doctor, about prevent. So, can we prevent diabetes? And, what are the measures to prevent diabetes?
Okay, so that's also a good question. I mean, all the pre-diabetics as well as the diabetic patients, they have to do this most of the preventive measures.
Yes.
So, the preventive measures are first of all to maintain your healthy weight.
Okay.
If you
Maintain
maintain
healthy.
your healthy weight, like this BMI, as I mentioned, between 18 to 25,
Okay.
so that definitely will prevent the risk of diabetes. Plus, physical activity is very important. If you do physical activity, exercise regularly,
Mhm.
45 minutes of cardiac exercises per week. So, and healthy habits of the eating diet, it is also very important. If we come to the low carbohydrate foods, So those are the food habits also very important, which we can prevent diabetes by doing this lifestyle modification.
Yes, yes, doctor. So, doctor, this year it was very special because we have coronavirus. So, the most one of the questions is why the diabetic patients are at high risk for COVID-19.
Actually, this is usually I will tell it's like a misconception. Diabetic patients are slightly at higher risk of developing a COVID-19 because what happens in all diabetic patients, there is a high blood sugar in the body. So
Okay,
whenever there is high blood sugar in the body, it causes some kind of oxidative stress in our body. So the
okay,
cells are more vulnerable to get any kind of the infection. It's not only COVID-19, but other kind of the viral and bacterial infections are also a little bit more prevalent in patients of diabetes. But the thing is that if a diabetic patient develops COVID-19 infection, in these patients particularly, the risk of complications are really very high because in these diabetes patients we know that there is a lack of immunity. So whenever there is superimposition of any kind of infection like COVID or any other bacterial,
okay.
those patients have increased infections in the body because of the lack of immunity. So risk of the complications are also more in patients of COVID-19 plus diabetes.
Okay, doctor. So, talking about foods, what are the best foods to lower my blood sugar?
Yes. Uh, this is a very general question, and I will just give you the brief highlight about the food habits. So, in a normal person, our carbohydrate content should be around 40 to 50% of the daily food calorie.
Okay.
Protein content should be around 20%, and the fat content of the total intake of the food, daily intake food, it should be around 30%. So, we have to balance this food. And now, if we talk about the carbohydrate food, each and every food when we eat, there is a glycemic index in the particular food, which depends on the sugar content of that food. Okay,
Uh,
so normally, if the glycemic index is less than 55, these are the very good food.
okay.
If the glycemic index is between 55 to 70, there is a moderate amount of the sugar content in the food. And if it is more than 70, that means it is highly sugary content food.
Uh,
So I will just give you brief example. Let's take the example of the fruits.
Fruits.
So in the fruits like apple and oranges, peach, they have low glycemic index, less than 55. So these are the foods it's you can eat. Foods like mango, they have moderate glycemic index food. So in that you can, I don't say avoid, you can take but in limited quantity.
Limit quantity.
Yes. But another fruits, for example, like watermelon, which is a very high glycemic index content inside there.
Uh,
So it is better to avoid those kind of the food. If I give you another example of the cereals, like whole grain bread is there, so which has the low glycemic index, while rice bread, then some cookies, cakes, these are the high glycemic index food. So we need to avoid it.
yeah, of course. Great. Doctor, there is another question. Like, if I have seen there is high blood sugar during my pregnancy, is it dangerous?
It is dangerous
Yes.
because not all pregnant patients will develop diabetes during their pregnancy, but in some pregnancy, due to some hormonal changes, because in any pregnancy there is a insulin resistance is there.
Okay.
So with pregnancy, when the person having a increase of blood sugar, in this patient they are not able to catch up the sugar particularly because there is insulin resistance is there. So in this case, there is increase of likelihood of diabetes during the pregnancy. So again, we have to detect at early stage. So if the diabetes in pregnancy, if we cannot control it properly, then the risk of complication occurs to the mother as well as the fetus.
Okay.
Other complications, there are increased chances of the blood sugar, increased chances of the protein passing in the urine. The mother will have swelling of the food. And from fetus point of view, the usually when diabetic occurs in the pregnancy, the birth weight is actually it is more. The fetus size is more. So in this case, there are chances of some complications occurs due to fetus, and unfortunately, many of the times we have seen if it is not controlled properly during pregnancy, then there are chances of the stillbirth also occurs. So that's why control of diabetes in pregnancy is very very important.
Okay, doctor. So, doctor, why is it important to treat gestational diabetes?
Yes, again, as I mentioned earlier, that it is very important to treat the gestational diabetes at the right point to prevent the complications. So, as you have seen that in the normal diabetic patients and the gestational diabetic patients, the normal values are little bit different. In gestational diabetes, we have to treat sugar more strictly. For example, if the sugar is more than 95,
Okay.
in a fasting blood sugar in pregnancy pregnant patients, it is considered as a high sugar compared to the normal individual. While they have more than 126, it is considered as a high blood sugar. So after food also, after 2 hours of the food, it should be less than 140. So it's again unlike the normal persons, while the sugar is more than 200
Yes.
without pregnancy. So that's why we have to control it
Control.
very strictly.
Okay, doctor. And it will remain after childbirth also, doctor, or no?
Uh, Not all gestational diabetes patients will end up in the diabetes at a later stage, but there are few chances, like 5 to 10% chances that the after pregnancy the diabetes usually remains in the body, and the patient has to take medicines for that also. So that is why we recommend that whenever the pregnancy with diabetes occurs or gestational diabetes, these patients are at high risk of developing diabetes mellitus. So after pregnancy, they should uh, check the diabetes levels, hemoglobin A1C, which is called as a percentage of the sugar, regularly every 3 to 4 months to detect the diabetes at the early stage.
Okay, doctor. So, doctor, how do you treat diabetes in pregnancy?
Okay, diabetes in pregnancy can be treated by two ways.
Okay.
First of all, we can treat by the giving the medications, which
Okay.
is called as a metformin. Uh, the metformin has came quite since a long time. It has been there since many years. It has been there, but previously that was during according to American diabetic guidelines.
Okay.
They were not giving the metformin before the quite few previous years. So we were giving injection only, which is called as a insulin.
Insulin.
But now, yes.
Okay.
So but nowadays, uh, since many years also, we have been giving metformin, which is a good medicine, which controls the sugar. As I mentioned in during pregnancy, so whenever there is gestational diabetes, there is insulin resistance is there, right? So if we give metformin, it prevents the insulin resistance or controls the insulin resistance to some extent. Plus, it also helps in maintaining a healthy weight. So this acts by two ways, metformin. So we can give initially the medicines, like starting with the small dose 500 milligram 2 to 3 times a day. We
Yes.
can increase up to 1000 milligram 3 times a day. So if it is still not controlled with that 1000 milligram 3 times daily, then we need to start insulin for this patient. So different regimens are insulins are there, like some long acting insulins, some short acting insulins are there. So generally, we start with the long-acting insulin in the treatment of uh, gestational diabetes. Like to start with like 10 units, 15 units per day during the night time. And it should be, we should call the patients regularly,
Monitor.
every weekly, to follow up with the chart. Patient has to be given the blood sugar chart. They will do the monitoring at home and then consult the doctor at frequent intervals so as to maintain the sugar level below the range.
Yes, Doctor, our life we start. We know now we know about what is diabetes, the factors, what the treatment, everything. Now the question is, what are the precautions a diabetic patient should take?
So all the precautions the diabetic patients should do to prevent the target organ damage.
Yeah,
For example, let's get example of the eye. So all diabetic patients should have annual ophthalmology checkup.
annual.
Annual, every yearly, they have to do the ophthalmology checkup.
Okay,
So ophthalmologist will dilate your fundus and they will check inside the fundus to see if there is any development of retinopathy is there or not.
okay,
So development of retinopathy, it's very earlier we can diagnose before the blindness actually occurs. So annual ophthalmic checkup is very important. Another important target organ is the heart. So since diabetic patients have chances of silent myocardial ischemia, that means if a person is having less blood supply in their heart and the heart is becoming weakened, so it is very difficult to diagnose early because these patients will not develop chest pain because the pain sensory organs has been decreased in the patients of diabetes. So to diagnose early any heart problem, again I will tell you, annually they have to see by a cardiologist and they have to do the checkup for the ischemic heart disease. Like they have to do ECG, treadmill test, echocardiography. So that is to prevent the heart problems in the patients of diabetes. Another thing, to prevent the kidney damage. So annually again, patients have to do urine microalbumin test. So microalbumin is a protein which is filtered in the urine. Okay, so in patient with the diabetes, the microalbumin in the urine is increased. If it increased to too much extent, then it will cause the kidney damage. So if we diagnose early, earlier stage when if there is microalbumin is there in the urine,
theory.
then we can take some medicines and prevent the further kidney damage. So these are the very important precautions all diabetic patients has to take.
Okay. Doctor, for example, now I know that I'm diabetic patient. So, what are the treatment options I will have?
Okay, so nowadays, diabetes is a very high, huge topic. Lots of researches has been going on throughout the world. So the treatment options are medicines and injections.
Injections.
Before quite a few years, we have very few limitation of the medicines were there. That means if patient not control with the diabetic medicines, suddenly we have to start to the patient to the insulin. But now there are, alhamdulillah, there are many medicines are available that initially if we start with the glucophage, which is called as a metformin, to titrate to the dose to the optimal level. If it is not controlled with the glucophage or metformin, then we can switch to the second tier medicine, which acts the sugar control through the liver pathway. There is another medicine which controls the sugar by decreasing the absorption of sugar from intestine, which is called acarbose. And in the recent year, new medicine has also come, which decreases the absorption of the sugar from kidney. So these are many good medicines are available for the diabetes. So if generally we try with those medicines, and the most important is to control that hemoglobin A1C, which is the percentage of the sugar. Our target control of the percentage of the sugar is less than 7%. So even after trying all these medicines, if it remains beyond 8, then we have to start with the injection. So as I mentioned before, we have different injection options are there. Yeah. So short acting insulin, you can give 3 times daily injection, and there are long acting insulin. It's just once daily injection, and it has 24-hour effect control. So different types of the insulins are available, and we need to titrate it according to the patient need and patient's blood sugar control and the percentage of the sugar.
Oh, yeah, yeah. Doctor, like, for example, my mother, she is taking medicine, okay?
Okay.
While one of my friends, he's taking injection. So why, doctor? Why is it different?
This is very good general question. So again, it depends on individual status of the diabetes persons. For
Okay,
example, many of the patients, if we give medicines, and alhamdulillah, their sugar is very good control, hemoglobin A1C, which remains less than 7%.
okay.
So if it is there, then these persons, they have to take the uh, medicines only.
Anything on the
While if it is not controlled with this routine medicine, they have to start with the insulin.
insulin.
Now, another thing is that there are two types of the diabetes. One is the type 1 diabetes and the type 2 diabetes.
Yes.
Okay, so type 1 diabetes is basically it is called as insulin dependent diabetes.
Okay.
Generally, it occurs in younger population, less than 25 years of age. So what happens in the insulin dependent or type 1 diabetes, that the pancreas, which they are the isolate cells and the cells of the insulin has been situated, that has been damaged.
Okay.
So they will not produce any kind of the insulin, or very minimal amount of the insulin has been produced. So in these patients, if we give whatever types of the medicine, it will not affect, because insulin is not produced from the pancreas. So these patients, they have to remain on insulin lifelong.
Yeah.
So those patients taking the insulin straight away. While in type 2 diabetes, we have options are available, like medicines. If not controlled with the medicine, then you can go for the injection. So that's why there is a difference. Some patients taking medicines, some patients are taking injection.
Yes. So about insulin or injection, insulin is available as oral and cream. What is the difference between them?
Okay. Before quite a few years, it was available in the vial only.
Okay.
So patient has to take the syringe and inject in the body.
Yeah.
So that was quite a long time. Still, also like many of the people are using vial, but the new technology has came, that insulin has been incorporated into a pen. So this insulin in the pen, which is more thermostable. So, if insulin remains in the outside temperature, like hot temperature, for some time,
Yeah.
it's kind of the protein, so it gets destroyed. So it is becomes useless after exposure into the sunlight and the hot weather. If we take the pen it is more thermostable, and that is why many of the people are taking pen, because the vial we have to put in the refrigerator. So at the time, yeah, if the patient take the vial from the refrigerator, take the injection and put the vials back, so it is very cumbersome. While if the patient has the pen, so it is more thermostable, so they can keep in the pocket whenever
Okay.
they go for traveling. They can
Yeah.
use very widely. So that's why most people are preferring the pen nowadays.
Okay. Okay, doctor. Doctor, if I have diabetes, do my children also at high risk for developing diabetes?
Yes, there are increased chances of the diabetes. If parents have diabetes, then there are likelihood of that children will develop diabetes. Again, this depends on which kind of the diabetes parent have. For example, if parent have type 1 diabetes,
Okay.
that means insulin dependent, which is has more genetic component is there. So in this case, almost 10 to 15% chances are there that siblings can develop diabetes. While if they have type 2 diabetes, the chances are still there. If both parents have the diabetes, then there are more chances that the child will also develop
Diabetes.
diabetes. Yeah, so that's why it's very important that when the parents having diabetes, we need to screen at an early stage to detect it early.
So, doctor, do I need to monitor my blood sugar even when I'm feeling fine? And there is nothing, I'm feeling not, there is nothing, but should I monitor my blood sugar?
Yes, actually, it is better to monitor the sugar at regularly basis. So means if a patient have like type 1 diabetes, so
Okay.
in this case it is better to do at least once a week fasting sugar as well as the postprandial blood sugar. So like
One
after
food.
postprandial, so after 2 hours after food,
Food. Ah.
just to see that the sugar level is not increasing. And it is also the same in patients of the type 2 diabetes. Like type 2 diabetes also, they have to regularly check. Nowadays good company is producing the glucometer, so they have the options to take the blood sugar at home. They can take the chart, and when for the next visit they can see the doctor. So even if it we are fine, as I mentioned, it's like iceberg disease. So we have to monitor it regularly, and the percentage of the sugar, which is the 3 months average of the sugar, that every
Mm.
3 monthly the person has to go for the checkup of the diabetes, and full checkup has to be done. Like they have to do cholesterol checkup, kidney checkup, liver checkup, everything they have to do regularly. In addition to checking with the diabetes, I mean the blood sugar level.
Yes, yes, doctor. Doctor, now I'm talking about sugar is high, right? So what will happen when the blood sugar is low?
Yeah, it mostly occurs in person with the type 1 diabetes, basically. So, what happens that if a patient is taking a insulin injection,
Yes,
and then suppose the patient is not taking food,
food,
so in
yes,
this case, the insulin acts on the body, and the whatever blood sugar is in our body, it decreases. So, it definitely it will go rise to the low blood sugar.
yes,
And again, I will tell you another most important thing is low blood sugar also occurs during the days of Ramadan, as you know. So during Ramadan, most of the people are fasting, and many of the people are diabetic. So we give them a strict education to how to take the injection, how to divide the doses, and to in order to prevent the low blood sugar. So usually low blood sugar has like it depends on how much low blood sugar in your body to develop the complication and the symptoms. So if it is very mild low blood sugar, like for example, if it is 60 to 70 milligram,
Okay.
so that patient may develop some like headache, some dizziness,
Mhm.
mild perspiration. If sugar goes less than 40, then those patients develop chest pain, breathing difficulties, and palpitation. That means the increase of the heart rate.
Great.
Yeah, but if it is sugar goes to the very critical low, if it is less than 30,
Okay.
in this case it is quite a serious because brain needs sugar for this metabolism. So
Okay.
whenever the blood sugar goes to the critical value,
Yeah.
the brain will not get the sugar,
Sugar.
and the patient will. I have seen many patients coming with the unconsciousness. They become comatose. So that's why it is very important to maintain the
Mhm.
sugar in the range, not low, not high too much, and not low too much also.
Okay. Doctor, we are talking about so if patient have diabetes, so some they have insulin, some they have medicine. So the question is, they will take medicine for lifelong?
Uh, few of the patients have to take the lifelong medications. I,
Okay.
again, if when I come to the question of the controlled sugar, for example, if the diabetic patient have like hemoglobin A1C, which is
Okay.
the percentage of the sugar, if it is continuously maintaining less than 7, more than 6.5, it is diabetes. But if it is continuously maintaining less than 7, in this patient, if we do the lifestyle modification, for example, strict diet control, control of the weight,
Wait.
doing physical exercise,
Okay.
so these patients can revert back to the pre-diabetic stage or maybe normal stage.
Okay.
So this is the general thing. But if from the start point of view, if the starting the blood sugar is very high, the percentage of the sugar is very high, then there is less likely chances that we can stop the medicines. So they have to come uh, and take the medicines lifelong.
Okay. Doctor, there is one question. Like, if is there is any surgery of for diabetes or any other recent treatment available? I mean, you know.
Yeah. Okay. You know, in the world, many recent advances has been occurring in the field of the diabetes. So again, surgery is not directly aimed to control the diabetes. Like for example, if a patient is obese, okay, in his body mass index is more than 40,
Okay.
in this patient we call as a bariatric surgery. So bariatric surgery is you must have seen like gastric bypass surgery, those kind of thing. So if we do the bariatric surgery, it will reduce the weight, and by reducing the weight, it will control the
So, diabetes.
diabetes. That's
Yeah.
the indirect pathway. Another also one important surgery, and many trials has been going on, that some intestinal bypass surgery.
Okay.
If we do that, then the sugar if we eat, it directly passes through the intestine, and it bypasses the pathway of the pancreas, and in thereby it controls the sugar. So one of the surgeries, intestinal bypass, although it's not yet FDA approved, but many trials has been going on, and many patients has really benefited with the help of this intestinal bypass surgery. And
Great.
another most important means the development has been going on for the insulin secreting the cells, which is called as isolate cells, that pancreatic transplantation.
Okay.
So isolate cells which extract from the one another person's body and inject into the person who
Diabetes.
has diabetes, especially type 1 diabetes. So in this patient, the cells which has been transplanted in diabetic patient, which grow and ultimately it will produce insulin. So that is also it's very, I mean, promising results. But still, I mean, the trials has been going on. Inshallah, I think it will be in near future. It will be good news for the diabetic patients.
Doctor, to finish for the last question, what general advice will you give to remain healthy?
Yeah. Okay. So again, it is just to summarize the whole session. Uh,
Yeah.
General advice I will go. It also starts from the diabetes, the word itself. Okay.
Okay.
So like let's say D. So D means diet.
Okay.
You have to choose very healthy food. As
Food.
I mentioned before, the low glycemic index foods, you have to select it. High glycemic food index foods, you have to avoid it. So diet, it's very important.
Right.
Means infection.
Infection.
So much for infection.
Okay.
All the diabetic patient should maintain very clean hygiene, because there are chances that foot infection occur, skin infection anywhere.
Okay.
So it's very important to prevent the infection.
Infection.
Okay, so A means act wisely and immediately.
Okay.
As soon as you detect diabetes, you should not wait and
Okay.
should properly follow your doctor's advice, whether to take medicines, how frequently you should do regular checkup, how frequently you should monitor, and it's like this. B means BMI. Again, very stressful. I will tell you that BMI,
By
it should be
asking.
maintained between 18 to 25.
Right.
At least those patients who are obese, they should try and to come in
Because
between overweight situation.
yeah.
If those who are overweight, they should try and maintain the BMI bit to go to the normal range. So maintain BMI is very important. E comes to the exercise.
Of course.
Physical exercise is very important.
Yes, doctor.
45 minutes per day, or at least 150 to 170 minutes per week. You
Very
have to do anaerobic exercises. That is very important.
important.
T, it comes to the target organ. So target organ. So it's very important to preserve the target organ and to prevent the early damage to the target organ. So annual eye checkup done should be done. For the checkup for the heart has to be done annually.
Okay.
You should do regular checkup of the urine microalbumin to prevent the complications of the kidney damage. So that is for the T component.
Yes.
E again, it comes to the education.
Yeah.
So
Important.
you have to properly educate yourself as well as the others also about the what is diabetes, what are the precautions,
Because
why it is dangerous. So education is very important, not only for you, for other persons. For example, those parents who have diabetes, they can educate their children to in order to control it properly and to prevent it. And most important, S means stop smoking.
yeah. Stop.
So very important. Smoking is additionally increases the risk for the complications of the diabetes as well as the pre-diabetics. So
Yeah.
it's very important. You have to remember this diabetic mnemonic very properly and you have to follow it. So if you follow this properly and accurately, I am sure you will remain healthy.
Inshallah, inshallah. Thank you, doctor. Thank you for this presentation. It was very nice and very rich of information. Thank you. See you soon, inshallah. See you all in other live, inshallah, on Facebook with the Burjeel Medical Center, Barari in live. Salam alaikum.
Thank you so much, Hamza. Assalamu alaikum.